From a patient's perspective, CLL is not a solved problem, and it should be that way from everybody's perspective. Yes, we've made tremendous progress, but most patients, while living longer with CLL, many reach a point where they run out of treatment options. Also, patients are immunocompromised, and because of that, we have a higher risk of infections, including fatal infections, and we higher risk of second malignancies. So anything we can do to reconstitute our immune system has to be looked at. Because of all of this, we need a multidisciplinary approach. So the most important people on that is our clinician, our local doctor who takes care of us. But that doctor may or may not be someone who has great experience in CLL. And if they're not someone who wakes up and thinks about CLL and goes to sleep thinking about CLL, sometimes it's a good idea to have a second expert on that team, a world expert, and those two play well together to help the patient. Because of our immunocompromised circumstances, patients need someone in their primary care area that's making sure they're getting appropriate vaccinations, they're getting age and gender appropriate cancer screening, they're getting their routine checkups for cardiovascular risks and other things. Bone health is an issue in CLL. All of these things need to be taken care of, and it's a lot to ask the hem-onc to be doing all of that. So you need this whole team to be taking care of it. Above and beyond that, some 40% of CLL patients seek help for a mental health issue within a month of their diagnosis. And that doesn't necessarily mean they have to see a psychologist or a social worker or a psychiatrist. It could be maybe they should be involved in a CLL support group. CLL Society has 40+ support groups. Maybe they want peer-to-peer counseling. Maybe they need some chaplaincy service. We offer all of that stuff for free. Maybe they just want to talk with another CLL patient. There's all kinds of things that could help them. Financial issues. Some of these treatments are extraordinarily expensive, but usually there's ways around it, but it takes some sophistication to know how to do that. So there's services that can help with that. So financial help is really important. And I think one of the biggest issues is just family support. A lot of these therapies are difficult to go through on your own. You have doubts. They're physically difficult on some patients. So having a loved one, a family member, a good friend who's a care partner in this is a critical part of your team.